Good afternoon. I'm with your local news channel here today to interview the primary nurse in the case of Jennifer Barger. I want to begin by asking, how did the error occur?
My name is Leslie. I was a primary care nurse in Jennifer Barger's case. The error happened on my part because it was a handoff miscommunication. Some things were discovered that were not communicated to the healthcare providers or the other nurses, and so that's how the incident happened.
Okay, could you go a little bit more in detail about that miscommunication?
Yeah. So Jennifer had a barium swallow test that she had to complete Monday, and that was her final exam before she had to go home. And so whenever we were in the procedure, it was discovered that she had a TEF, which is basically a little hole in between that connects your trachea and your esophagus. And so whenever the barium went into her lungs, she went into respiratory distress, and that's how we found the TEF.
Okay.
After that, to help with her ventilation, the healthcare provider ordered mechanical ventilation, but it was not communicated that the patient had TEF. And so all the air that was supposed to be going into her lungs was going through the little hole in her trachea and esophagus, and it was going all the way into her abdomen, which led to hypoxia because she wasn't getting no oxygen, and it led to her just receiving air for hours into her abdomen, and that's what led to her death.
Do you think that there was anything that could have prevented this error?
Yes, I do. So just like when we give medications, we have like risk prevention strategies, which include right patient, right medication, right route, dose, and time. And all of these just help minimize the risk that we will give patients a dose or a med that can result in their fatality. And so I think that there could have been guidelines or strategies to help prevent this from occurring again.
So it sounds like the 5 rights to medication really help in the situation, to not give the patient the wrong dose or give the wrong patient the medication. So can you identify like a few risk strategies that'll help with the communication side of a patient safety event?
Yes, so a lot of nurses are usually very busy. I feel like it would be very beneficial if they set some time aside to give, a complete SBAR, like a quality SBAR that includes all the information needed, that they set aside time for the incoming healthcare team to ask their questions, clarify any miscommunication that could happen and occur in these situations. I feel like SBAR training can also be beneficial in any new nurses that are coming into the field. I feel like it would also be beneficial to have an electronic sign-off that signals that the primary care nurse has gone through the chart, looked at everything before they have had time to go and look at the patient, so that they know completely what's going on and what assessments they need to complete, so it can minimize the risk for miscommunication. Next, we're going to interview the nurse unit manager.
Hi, my name is Ashley, and I was the unit manager who was in charge during the Jennifer Barger case.
Hi, Ashley. So what constitutes as a patient safety event?
So a patient safety event occurs when there's an action or an act of omission that results in unintentional patient harm, or it could even result in hazardous healthcare conditions as well.
Who is responsible for maintaining patient safety?
Nurses are actually responsible for maintaining safety, and they can do this by following organizational policies that identify risks and reduce patient harm. They can do this by planning patient care, reassessing that patient care, and ultimately communication with the whole healthcare team.
What is the procedure when a patient safety event occurs?
Okay, although policies and procedures vary from different organizations and hospitals, there's usually an incident report that is filed, and this goes through your chain of command. You would double check with your charge nurse and the nursing manager and see what is the procedure to follow to file that incident report.
And why was this classified as an error?
This was classified as an error because Jennifer Nabarger's nurse failed to provide that communication that she had the TEF. So it was in her chart, it was a diagnosis, but there was no double checking of the into the chart system, and it was failure on the nurse to communicate that to the next nurse on shift.
Next, we have the nursing educator for the hospital. What are the national patient safety goals, and why are these important?
The purpose of the national patient safety goals is to improve patient safety. The goals focus on problems in the healthcare safety and how to solve them. To ensure these safety goals, we should identify patients correctly by using at least 2 forms of identification. We should use medication safely, use alarms safely by ensuring alarms on medical equipment are heard and responded to on time, prevent infection, identify patient safety risk, and reduce the risk.
Okay, and what are potential risks for patient safety?
Unintended injury is one of them, prolonged hospitalization, physical disability that results from medical or surgical patient management, death can even occur due to medication errors and negligence.
Okay, and what are the roles of nurses in prevention of patient safety events?
Ask for assistance when dealing with high volume or medically complex patients. Monitoring and observing patients regularly is a key aspect of a nurse's role in patient safety. Communicating with the patient to identify their needs and take appropriate actions.
Okay, and how could the nurse ensure patient safety?
Compared to Jennifer's case, before the handoff was completed, the nurse should have verified that the receiving nurse understood by verbally repeating all the critical information such as lab values, medication doses, urgent actions and procedures done or that needed to be done.
Okay, we have a family member of Jennifer Nabarger with us today. What was the outcome of this case and what happened to the nurse?
So unfortunately, my uncle didn't receive any acknowledgement from the hospital for their mistakes. Therefore, he decided to partner with the patient safety movement, and basically they bring awareness to patient safety events to try to prevent patient harm. And they only got their hospital bills paid, and that was about it.